Hey, everybody. Thank you for our weekly privacy chat. Almost every week. We do take a break every so often. And I'm thrilled that you're all here with us. I'm Jules Polonetsky. As you know, you're on my page here, and delighted to have with me some of my colleagues from FPF, Jeremy Greenberg, who is one of the authors of the paper that we have discussed. A couple of our team in the background who helped cue this up and make it happen. Thank you to Ben and Payal. And our guests for today, Joshua New at IBM and Christina Montgomery. Christina and Josh, old friends. Christina, the Chief Privacy Officer, plays a lead role on ethics, on data protection, on all of the challenges that a major global tech company with a brand and a commitment to try and figure out how to do things right, and lots of different technologies and lots of real hardcore science. So learned a lot from Christina over the years, and happy that she and the team at IBM have collaborated on this paper. We're going to start by turning to Josh. Brain-computer interaction. I do confess, like many, this was a kind of a science fiction thing, for me, having, read all the fun books and speculation out there and occasional coverage of Elon Musk implanting things in pigs of brains and, stuff that just seems kind of bonkers. But at the same time, I've also seen some very practical things in the medical care side of the world. We hold an annual program with Highmark Health, one of the providers in Pennsylvania, with hospitals and Blue Cross Blue Shield. And this past year, we had a demonstration by a doctor who's a leading expert in the care of different neuro diseases. And he, with a clicker, a remote in his hand, turned on and off an implant in one of his patients who was, nice enough to be, volunteering to show. And when he clicked this off, the gentleman's tremors were uncontrollable, and you could see how challenging this was, for his life. And then with another click, his brain received the message from this clicker and, clicked back on, the device, and then there he was, stable and able to function well. And so I hadn't seen that displayed like that before, and I've heard from people since that, yes, like, this has been an incredibly important, intervention. And so it seems like there's some very practical stuff in the market already, bringing benefits to people who need this as a medical intervention. We've seen, obviously, gaming and browser control and mouse control type things, in the market as well. There are even app developers who are using some very, basic and cheap technology, a headband and an app. And so this is, not far off. Certain developments are already in the market. Tell us more about the state of the technology. Is there really a point where I'm going to be, controlling my computer, my mouse, my car, my devices with my thoughts? Are critics, marketers, advertisers going to be, scooping up those thoughts? Is that, fantastical? What's real here? What's here now? And what's likely? Why is this a big area of research for IBM? Clearly, you see opportunities here to really build businesses or advance research that's going to be important.
Sure. So first of all, thanks, Jules, for having us, and we thanks again for the opportunity to collaborate with you all on this paper. I think, understanding what we're talking about here was one of the main focuses of this report. I think there's a lot of similarities to how AI was conceptualized. The common understanding of what the technology is and can do in the public understanding is wildly mismatched compared to, what it's actually doing or what it could be doing in the future. If you look at AI conversations about 10 years ago, talking about the Terminator, talking about the sci-fi kind of pop science concepts, when in reality, it's a dramatically different conversation that's being happened, people that are actually making these technologies. So where we are mainly seeing this technology today kind of falls into two camps. One, as you mentioned, in the sort of medical research context, this is where IBM research is involved. in the application of brain-computer interfaces for pain management, for rehabilitative devices, for the control of prosthetics, things like that. But again, that is still early days. These are not commonplace. They are still a very active emerging field of research. And then on the other end of the spectrum, we have what could be more classified as wellness devices. These are non-invasive, they're not implantable. They have some cool functionality, but they're pretty limited in what they can actually do and what we can infer from the data that they collect. In the future,
what's an example? Is that like a headband that might give me some feedback? Like, am I calming myself well? What kind of wellness devices do we see?
Yeah, so I've actually used one of those devices, and I won't mention brand names, but they monitor brainwave activity, and it's for device use while meditation, and you can observe how different brainwave patterns are heightened or more active if you're in like a state of distress versus how calm you are. And these are fascinating, but they are sort of niche enthusiast kind of devices. They're not necessarily a mass market, widely consumer friendly product. But as these technologies develop, it is very early days. So we want to make sure that we're not being too authoritative with our predictions of how these technologies are going to go. They are very complicated. The human brain is enormously complex. And then, the hardware is one problem, and the software is another that relies on really advanced AI to clean all this data, to classify it, to identify it, to actually make it actionable, will be a huge challenge. But an important point of this paper was, demystifying this technology and clarifying some of the hype around this. These technologies can't today, nor do we anticipate them in the for quite some time to be able to read your thoughts, to control your actions, to tell if you're lying. That is purely, in our opinion, speculative fiction, at least for the foreseeable future.
Well, let's get into how it actually does work, right? So we know that there are some places where there are, again, these medical interventions, and where maybe people with disabilities who need to control a mouse or a cursor, have a technology that is actually interacting directly, right, with their brain waves by literally being implanted. And it sounds like AI or machine learning has helped refine understanding of the signal so as to know, yes, this is a command to move a mouse or the like, right? Most of us presumably are not going to be implanting things unless we're really dealing with a medical situation or a physical disability. But it sounds like simply putting on a band that is close enough to my head that the signals can be analyzed in a way that, at least as you indicated, shows different levels of calming or the like. Is that, but once something's not on me, do we know what's the state of, am I going to have today I have a camera, maybe I'll have a sensor on my next laptop that lets me control the cursor in some way, or do I still need physical proximity at this point or the like?
Sure. So right now, these the two camps that I mentioned, basically invasive or non-invasive. So invasive would be surgically implanted on the brain, or a headband type of external device. That is a pretty good indicator of kind of their functionality or utility, based on how much data you can collect, how accurate it is, what kind of potential utility you can get out of a device like that. That may not always be such a clear distinction in the future, just because we could anticipate the functionality of an external device, of a headband, for example, increasing to be able to perform applications that could only be performed with an implantable device, and that poses some really interesting challenges for how we think about regulating these technologies, and their how we protect the sensitivity of this information. In terms of can you like remotely sense people's brain activity and for their thoughts or their intentions, like to control a mouse? We did not really find examples of that being feasible in the near term. You do have to be very close to the source of this information. And importantly, neurodata is really messy. There is a lot of activity that these sensors can collect that are neural signals, but they're not particularly useful or actionable. So when I'm blinking, or electrical activity from my heart, or just muscle movements in general that are there kind of autonomous, don't really reflect what I'm thinking about or what I'm doing, all have to be sorted and analyzed and then removed from actual kind of actionable kind of data, these features that you extract from this massive stream of information.
So Christina, a lot of what Josh is describing seems like, whether we understand it well or not, likely to be biometrics that, as you fit these things into your kind of global data protection thinking, do we already have a pretty good framing? I mean, it's new in that it's, technology that's really first evolving. But it certainly seems like it's just another form. Am I oversimplifying? It's just another form of biometric. I may not be swiping or being photographed, but it's a perhaps unique signal to my body that already, therefore, should be captured, whether we solve all the ethical issues or not. Just at least putting on our sort of data protection lens. Does this seem to fit pretty clearly in most cases into the special category sensitive biometric data?
I think there's an argument that some of the more broadly drafted biometric statutes would cover something like neurodata, but others more narrowly drafted don't at this point in time. They're very specifically related to things like fingerprints and voice prints. There are examples, right? And then the other challenge is that the laws related to biometrics relate to biometrics or patterns that are used to identify a specific individual. So that connection or that exception for persistent identifiers, that concept, you don't necessarily have captured with respect to neurotechnology. So I think some arguments could be made, but that's one of the reasons for this paper as well, is to help us think now about what gaps there might be in the regulatory framework that we'll need to address going forward, if there are any gaps at all. That's one area.
And is it your take, I mean, the challenge, as somebody who's been working on these issues for a long time, the challenge in data protection always seems to be that if it's too soon, well, we don't really know what we're crafting, and are we being under-inclusive, over-inclusive, what are we targeting, what are we preventing, what are we enabling? And then the next thing you know, it's too late and people have already built technology and business models, and then all of a sudden, you're pointing out the application of the law to their business, and everything is confused and people are complaining and pushing back because it radically changes what they do. Or, where are we? Are we early still in this sort of process where we're really first sort of identifying the directions, and is it going to be too late pretty soon? How soon do we need to really start being really precise about what we're thinking about here?
Yeah, I mean, I think because in part some of the implications of this technology more longer term, and frankly, even in the short term, in terms of the impacts that they could have both beneficially and then detrimentally, it's why the paper was developed, right? And it's why we at IBM put out specific policy lab. Through our policy lab that makes policy recommendations, we put out a piece with some concrete recommendations that we recommend that policymakers and that manufacturers and developers of these types of devices take today. We think all privacy professionals really should start thinking about it, at least at this point in time. That being said, and start evaluating where there may be gaps in the regulatory frameworks that exist already today. And also start thinking about whether we should today start putting guardrails in place from a policy perspective. So for example, policy prohibitions against the ability or the use of neurotechnology in a way that has a legal effect on an individual, such as in determining whether somebody in a legal setting is telling the truth or telling a lie. Those kinds of things we ought to think about now. So are there broad guardrails we should put in place? Are there technical controls that we should be thinking about today to put on some of these technologies? For example, simple things you would think about with respect to any particularly invasive technology related to giving more control to the user, on-off controls, more education in the space around BCIs, what they can do and what they can't do. And then from a security perspective too, right? So if you've got something that is directly connected to the human brain, you want to be really careful that you've got the right protections in place from a security perspective to prevent hackers from getting in there, for example, that you're encrypting as much as possible. So what are those sort of technical controls and guardrails that we should be putting in place today?
Yeah, you certainly hear about some concerning reports that, things like, heart type monitors and pacemakers and other, physical IoT devices, haven't always been built with the thought of an adversary, in place. And it seems sort of like, of course, but, medical researcher is thinking about how to solve, a medical problem. And of course, you're only going to be in a hospital where this is going to be dealt with. And then next thing you know, some, bad actor has sort of cloned it and, and it's not a fantastical risk. Well, Jeremy, you were newer to this issue when we started approaching it, and it was great to find and connect with the IBM folks on it. But where did you sort of leave off in the where we are in the policy legal process at this point, and did anything surprise you about what was already available in in the market?
Yeah, definitely. As you said, Jules, I was super new to this issue. I had heard about these types of technologies being used in the medical or health space, but something that really surprised me was the use of this tech still in a very early stages in the gaming and entertainment space. This is something that I'm personally interested in. I look at a lot of issues involving virtual reality, and there are a lot of efforts out there. There's some research, there's some prototypes that involve adding a sort of non-invasive brain-computer interface, often an EEG sensor, as another sensor when someone is experiencing virtual reality. So this type of data collection could inform how the user might be feeling based on the content they are experiencing, whether the game is difficult or causing stress or too easy or relaxing. And I thought that was really fascinating in terms of creating this increasingly immersive gaming environment for increasingly fun or challenging games there. At the same time, this definitely opens up a lot of privacy risks. This is more data being collected. As Christina mentioned, it can be sensitive data. And the idea of combining that data with other data being collected and the risk of using that to make decisions that impact the user, what content to serve or not serve a user, for example. So that's something I found really fascinating. Another thing that really surprised me was there are some efforts and discussions happening around neurotechnology. The OECD has released their principles related to neurotech. There's some ongoing discussions there on a global level. And just the number of neuroethicists from academia, many of which interact with industry, interact with the startup communities related to the consumer uses of these devices, just how much discussion and writing is happening in that space. And sort of thinking about, obviously we need to think about the legal side of things, policy, but this also gets into, a lot of discussions around philosophy and, privacy of thought and drawing a distinction maybe between traditional notions of privacy and now this privacy of thought. So it's a super interesting field. It's still very much early days, but there's a lot of just fascinating discussion happening among a number of folks. So that's something that really surprised me and something that I enjoyed diving into in this paper.
Yeah, I guess there are some lessons from how we've perhaps well handled or not well handled certain issues. I mean, the gaming world, as many know, does do a lot of sophisticated stuff today to keep you engaged. You're losing, the game might get easier. You're moving the mouse one way or another. There's just a lot of activity already being gleaned simply from things like how you move your mouse, how you click, how you're how you're acting. Are you taking breaks? And it seems like this is in some way just going to be another method to get at some of those things. We saw our friend Professor Evan Selinger, calling for some, bans on eye tracking, for instance, because of concerns that, well, knowing what you look at now will be another way to know what you're thinking, what you're interested in. And, on one hand, knowing that I'm not looking at the road and, my seat's sort of buzzing to wake me up so I don't veer off, right? Like, of course, that makes sense. But I may or may not want an insurance company, knowing that I regularly doze off. On the other hand, I don't know, let's talk about it. If I'm regularly dozing off and I'm a, truck driver, doing 12-hour stints and I'm regularly dozing off, maybe I don't want to be punishing you. Maybe I want that information and like, hey, we have a problem. The drivers are, on the road too long. So these are really hard ethical and kind of policy related questions. And I remember when location was a novel sensor on the mobile phone and everybody was like, oh, we get that. That is very sensitive. That will not be used, for marketing. That'll be like a opt-in. You give location because you need directions. And the idea that maybe a profile of you or the places you've been, might be used, nobody's going to go there, right? And everybody went there. And now the platforms are putting in rules to, try to squeeze that genie back in the bottle. So I do think the more important piece, frankly, perhaps than getting, overly geeked out about the technology is to actually say, what boundaries do we want or do we already have because of law around these issues? And we're being forced to address them because we're talking about these technologies, but I'm not sure they're novel, new, right? What I read is pretty intimate as well. And we've kind of gone in some direction about whether what I read is available, right? We probably want privacy of reading, but on the other hand, we've given it up in some ways with, well, if you read it on a screen, then we know about it. So it's, I think, helpful to use this as a chance to say, it certainly seems sensitive, but we haven't always over time maintained those boundaries. Here's why we really do want to think through those boundaries and use those parallels to say, no, we don't want to make the mistakes of the past. We don't want, if everything I do when I'm looking at a screen ends up being tracked for the business models that have been built around advertising and marketing and tracking and so forth, and we don't want to replicate that here. Or are there places where gaming is going to, because that's how their business model works? So it's super timely, I think, for us to be really stressing and making sure that we put the rules in place so that the mistakes we've made in the past, right, whether they've been the right balance or not, don't carry over because this is more sensitive or because we have a new platform. So we have a new opportunity to maybe do it right. So on that notion of the platform, right, we see the platforms now saying block cookies, change the consent models, right? And everybody's yelling and saying, hey, you're advantaging yourself, you're this, you're that, right? So here we have perhaps new platforms, new techniques that are going to be used. What are the technical type things that people that are working on this should be thinking about so that we maybe build it in a way that doesn't allow the concerns that we're worried about to happen? So thoughts from any of you on sort of technical solutions that should be on our plate today?
Yeah, definitely. So I think a lot of the technical solutions that we should be thinking about, we are currently considering with other technologies out there that could be tracking folks. So, for example, something like encryption when data is in transit and at rest. That's something that's going to be very important here. As well as the use of providing on-off controls where possible, and having those controls easily accessible on device or on a companion app where practical. Some of these devices, especially in the medical context, need to be on for extended periods, but others in the consumer context, maybe not. And going off of that, providing controls to consumers, obviously the onus should not all be on the consumer, but providing those controls and really maybe needing to rethink transparency in this space. This is novel technology. It's really complex. We haven't figured out transparency on the 2D web yet. So now we're talking about new technology. This is something that could be integrated into immersive technology or the 3D web or spatial web one day. So really rethinking transparency in this space is going to be really important as well.
Well, speaking of transparency, one of the mistakes I think that we've all made is we're debating now the effect that the platforms have on the world, and we don't have access necessarily to the data, and we want access. We want researchers and other companies to be able to, not only debate, well, what's happening on the big platforms, but also what data on those platforms might reveal about whether they make you happy, whether they hurt people, whether they, right? I mean, there's a need for responsible, trusted access to data. The Europeans are moving legislation that, tries to make it easier or mandate. Professor Nate Priestley at Stanford has proposed legislation to sort of mandate access. How do you all see open standards or research data sharing so that this isn't something that's proprietary to one company or one platform, and that researchers and kind of the broader community not only can be there to study how this works and vet it and transparency, but also gain, so that the research is more equitable and open?
Sure. So there are huge, I think, barriers to entry in any emerging technology, but neurotechnology specifically because of, this hardware hasn't been invented yet. It requires a really, really rare, highly specialized skill set of both neuroscience and AI, and we're inventing this. It's not an established field yet for the most part. So one of the ways that we can help lower that barrier, we think, is to promote the use of open standards and sharing research. When you require such advanced technology to even do the basic kind of research here, that essentially means only the biggest players and the biggest institutions are going to have access to this technology, which we know from our experience with AI and other technologies in general, that we want a really participatory, inclusive ecosystem from civil society, from academia, from industry, from government, not just the people that can afford to shell out for their whole lab devoted specifically to neurotechnologies. So open standards for this kind of data, so it can't be locked into any one system, or so it can be freely shared, we think is really important to that. A general attitude of sharing research and open research, with proper respects to the sensitivity of this data, only sharing when appropriate or in a controlled environment, will be really critical as well. And there are some initiatives out there dedicated to this, platforms that are dedicated to the sharing of open data. There's an organization called Neurodata Without Borders, which is promoting open data standards for neurophysiology. You may have lost my video for a second, sorry. But that's a really important attitude that I think if we establish this kind of openness, inclusive culture as the field is being built, that will have, will influence the entire trajectory of this field going forward, rather than trying to force it to be more open and inclusive 10 years down the line.
So obviously there's a legal structure that needs to be in place. Perhaps much of it is in place, and it's a matter of understanding what gets captured properly by metrics, by discrimination, by many of the other rules. There's technology steps, deletion and encryption and other pieces. At the end of the day, there are going to be ethical questions that are going to need to be made, because they're going to be uses of the technology that may be, incredibly important for a medical intervention or else. And then there are going to be areas where we just don't think that that's the right balance for, society's interests against the individual. So ethics is going to play a bigger role here than in many other areas. Christina, this is perhaps the final word. You spend a lot of time on sort of ethics and how companies can, have ethics mean more than I follow my rules, so I'm ethical, but rather, what are the ethical review type processes? Let me let you close with sort of a thinking from how ethics at a company level, at a scientific research level, plays a role here.
Yeah, I mean, that's part of the reason why, my team and the AI ethics board at IBM has been involved in looking at neurotechnologies. So we, just to back up, look at, we will not as a company deploy a new technology into the world unless we're doing so in a responsible manner and with clear purpose. So we felt, looking at what's coming, the possibilities today and in the future for something like neurotechnology, that we ought to start a conversation about, what are the things we should be thinking through now? What are the guardrails we should be putting in place now that are as technology neutral and as possible, but take into account the implications that these technologies could offer going forward? So for us, from our perspective, we have our ethics board involved in looking at this. We put out the policy lab with recommendations on both technical controls and policy controls to kind of get others to start thinking about this as well. And I think, again, some hard guardrails that we'll put in place, at least for ourselves, and would ask that others follow in terms of what BCI could be used for, that it not be influencing decisions with legal effects, that it be fair. And sort of going back, I think from a privacy perspective and from an ethics perspective, there are common principles that we adhere to. Those don't change, that technology should be transparent and explainable, that it should be fair, that it should augment and not replace humans. Those types of things are sort of like the North Star for us. And I think when you think about, we talked a little bit about privacy and rules of the road for neurotechnologies, just privacy by design. And as you think about these new technologies and the data that they can capture, let's ensure as we deploy these technology around BCIs that, we're collecting as little information as possible, make it less identifiable, make sure that it isn't harmful to individuals, make sure that it is securely deployed. All of those concepts that we engage in as privacy professionals, as responsible technology companies looking at AI ethics, those apply equally in this context. Those don't change. That North Star doesn't change. It's the sort of the around the edges that we want to start a conversation about right now.
Well, for those who don't know, Christina's not just sort of talking the talk here. IBM was very early to say, we're not comfortable with the way facial recognition is being used by law enforcement in public. There are problems. And so we're going to, drop our program and really, freeze what was years of work and research because of the concerns that the ethics of hadn't yet been well structured and thought through. And some other companies followed, others, have not. So sometimes it actually takes saying, no, this isn't being used, is too easy to abuse or is too subject to misuse. Hopefully, we'll all figure out the limited appropriate ways to use facial recognition. I don't know, I want to log into my computer and phone, but no, I don't want my, every attitude or every step with my face being a, unique tracking identifier that could, just yesterday, Clearview AI filed some patents that would let average people in the street use technology, facial recognition technology to, learn whether maybe the person I'm trying to sell something to or sell a house to, whatever, is on some blacklist or the like. Just sort of, bringing this to the masses in a way that you can see terrible likelihood misuse or discrimination and look, a patent, as we all know, doesn't mean that something is going to be a product or can be a product, but it does start showing you what might be feasible or possible technically, and does warrant sort of thought from those of us who sit where we do about what we need to do to get in front of it and have the right rules and so forth. So certainly no bans here at this point. Certainly lots of regulations already applicable, but a good time to think hard about what could go wrong and how do we make sure that what we want to go right. Tools for medical care, tools for people maybe driving more effectively, tools for the yoga people of the world who want to really track how they meditate. I mean, we can't downplay that wellness stuff. That's a big market. And there are people who, want to learn how to, calm themselves and be serene, or will we learn what puts you in a good learning mode, right? I mean, what do I need to do? There's a lot of positive research, if done ethically, where we can learn about our minds. It's incredible how many medical things seem to be related to stress and tension and, having the right biofeedback that can, in one place just be wellness, in another place increasingly be understood to really be what you need to do to be healthy and function effectively and so forth. So super interesting conversation. We'll be sticking with this issue. Look forward to working with you. Thanks for those who listened in. Privacy by design is the solution at the end of the day, as one of our commentators point out. Hassan, thank you for your comments. And folks, we'll be keeping an eye on the comments. If there's anything interesting or useful, please do take a look at the report if you were interested. In it, Josh and Christina and Jeremy and team walk through many of the issues, the technologies. Have a happy Friday. Thanks everybody for joining me. Good to see you, Christina, Josh, Jeremy.
Thank you.
Thank you.
Thanks,
Bye.
Jules. Bye, everyone.